Okay, so I'll pick back up where we left off at pre-existing conditions. The payer in these cases has denied the claim because of the wording of the pre-existing clause in the patient's legacy health plan policy. And these are those that are effective on or prior to March 23rd, 2010. A pre-existing condition is any medical condition that was diagnosed and treated within a specific period of time immediately preceding the enrollee's March 23rd, 2010 or earlier effective date of coverage. Our action in these cases are to determine whether the condition associated with the treatment for which the claim was submitted was indeed pre-existing. So if it's determined that there was an incorrect diagnosis code submitted on the original claim, we can correct that claim and then resubmit it for reconsideration. Otherwise, the legacy health insurance plan will not cover the procedures or services. And I apologize because I think there's a little bit of a lag in my computer. Okay, here we go. The next reason for a denied claim is non-covered benefit. So for these claims, the denial is based on a list developed by the insurance company. So this list includes a description of procedures and services covered by the policy as well as those that are not covered, which most of the time are cosmetic surgeries. Our action to take in these types of claims are to determine whether the treatment submitted on the claim for payment is indeed excluded from coverage. If determined that an incorrect procedure code was submitted, we can correct the claim and then resubmit it for reconsideration of payment. If the procedure or service is not covered by the payer, the claim is not resubmitted and a bill is mailed to the patient who receives, they also receive the explanation of benefits from the payer that will indicate the reason for the denial. Coverage for denied claims. This occurs when the patient is no longer covered by the insurance policy. A reason for this could be that a patient has changed jobs and may no longer be covered under an employer's health plan. Our action in these cases are to contact the patient to obtain the correct insurance payer information, and then we can resubmit a corrected claim accordingly. With these types of claims, we're reminded of the importance of interviewing patients each time they come in for a visit on their any updates to their address, telephone number, employment, and especially their insurance coverage. Failure to obtain pre-authorization. Many health plans require patients to call a toll-free number located on the insurance card to obtain prior authorization for particular treatments. If the claim is denied because the service or procedure was not pre-authorized, in most cases, the claim can't be resubmitted and the provider must consider it a loss. In emergency situations, this is where the patient is receiving treatment that may call for pre-authorization, but they are unable to obtain that, them or their provider, because the treatment cannot be delayed. So it's like a life-saving treatment. These claims, although they're usually paid, payment might be less and penalties may apply. However, it's possible to have those waived. To do that, though, we have to, our action is to request a retrospective review of the claim and submit information explaining the special circumstances that might not be evident from review of the patient's chart. So those are our supporting documents again. Out-of-network provider used. So in these cases, the payer has denied payment because treatment was provided outside the provider network. This means that the provider is not eligible to receive payment for the procedures and services performed. The correct action that we can take is to write an authorized letter of appeal explaining why the patient sought treatment from outside the provider network. So, an example of this would be a medical emergency when the patient is out of town. The payment may be reduced and penalties could apply in these cases. Lower level of care could have been provided. So in these denied claim cases, the payer determined that the care received by the patient on an inpatient basis could have been provided on an outpatient basis. An example of this would be an outpatient surgery that could have been performed in a provider's office, or skilled nursing care that could have been performed by a home health agency. There's, I'm sure, lots of examples of this in the real world. But if the patient does have a good reason for the higher level of care, maybe they have some comorbidities going on or complications, an authorized letter of appeal can be written to explain why the higher level of care was required. But in those cases, we do need to be prepared to forward copies of the patient's chart for review by the payer. Incorrect codes or incorrectly linked codes reported on a claim. So the claim was denied due to incorrect codes or incorrectly linked codes. An example of this would be a CPT code being reported on a Medicare claim instead of a HCPCS Level 2 code, which is required for the claim. Or diagnosis codes and procedure or service codes are incorrectly linked on a claim. So there's no correct supporting documentation or claim submission for medical necessity there. That's what that's trying to say. Our corrective action would be to fix what's wrong on the claim and resubmit it to the payer. Okay. Bundled service or global period service is not eligible for separate payment. So our bundled services, the claim is denied because multiple procedures or service codes were reported when just one code should have been reported for a bundled service. So this is kind of like unbundling the codes, which is against the law. So this is one thing that we do want to make sure we do correctly. Or in a global period service, the claim is denied because it contains codes for procedures and services that are not eligible for separate payment because they were performed during the global period. So they should have been included with another code that was submitted. Our action for these is none because there is nothing to justify on these. Claim contained incomplete information or another insurance plan is primary. If the claim is denied because it contained incomplete information, resubmit the claim with completed information. So just basically resubmitting corrected claims. If the claim is denied because another insurance plan is primary, submit the claim to the payer first, the primary payer. Then submit a claim with a copy of the RA, the remittance advice, from the primary payer to the secondary payer for that whatever may not have been covered by the primary payer. Okay. So for this is what happens after our appeals have been sent in to the payers. Appeals undergo third-party payer peer review. This is an evaluation process performed to determine whether to reverse or uphold a claims denial after resubmission of previously denied claims. Evaluation of the appeal is performed by a medical reviewer, such as a nurse, or medical director, a physician, and if an appeal is escalated, an independent external reviewer, which would be a physician with the same specialty as the provider who performed the service, may assess the appeal. Peer-to-peer review is another element of appeal review. And that's when a patient's healthcare provider communicates directly with a third-party payer's medical professional about reasons for which services and treatments are medically necessary. This can help prevent the need to submit an appeal letter for a denied claim. So that's direct communication. And this is my closing note. So effective claims denial management includes promptly processing claims denials as they are identified so that reimbursement for the provider can be recovered as quickly as possible. This is very important. There are regulations for the payers and the time frame that they are supposed to provide reimbursement or a remittance advice about denial. So it's important that we also promptly process claims so that the providers, they can get paid. And I believe this is all that I have for you. I thank you for your time. I thank you for, I look forward to the future.